maybe at this point in the podcast, the biggest takeaway for me is like, just because it says it reduces blood glucose doesn't mean it's good. That's actually a bad thing. That means your body is not getting nutrients that it needs.
Yeah.
You know, glucose is a nutrient, you know, fructose and glucose together and sucrose and plant foods. That is something that humans need and animals need. Reducing that, just because a plant compound reduces that, we chase this in diabetes and think that's a good thing for diabetes, but that's actually depriving us of a nutrient. We should welcome the glucose influx when we actually understand what that does to the body in terms of a signal of abundance.
Low blood glucose and admittance in the hospital is one of the most reliable predictors of dying while in the hospital. And I think there's a reason why when you go to the hospital, even in the ER, and they put you on some kind of an IV drip, they don't put you on a lipid drip. And I don't think they don't even put you on a amino acid drip. They may later if you cannot eat, right? But the first thing they do is what? Glucose and electrolytes, right? Things like that. So there's a reason for that. And I think what was that? Blanking the name of the doctor who said when a biomarker becomes a target, it ceases to be a biomarker. So you're starting to chase something that's really was meant to tell you whether something is okay or not. It's not meant to be chaseable, right? You just use it to evaluate whether what you're doing is working. I think, but the reason why we're here is that currently mainstream medicine does not have a good idea of what's causing the diabetes.